Good afternoon, everyone. Welcome to another edition of COVID and You. My name's Liz Charlotte. I'm the Director of Communications at the Mississippi State Department of Health, and we also have joining us Dr. Paul Byers, our state epidemiologist. Say hi, Paul.
Hello. Thank you.
And our state health officer, Dr. Thomas Dobbs. Dr. Dobbs, why don't you make a few quick statements, and then we'll start talking about vaccine availability first.
Yeah, that sounds great. So I'm Dr. Thomas Dobbs, State Health Officer with the Department of Health, and we'll just do a quick overview. We've got a lot to talk about. We've got a lot of questions, and want to talk about the vaccine a little bit. As you are all quite aware, we're in the midst of a severe surge. Our fall surge has been going in very much the wrong direction over the last week or so. We're seeing, near record high case numbers. The consistency is pretty astounding. We're seeing extreme stress in the healthcare system. As some of you have seen, we have 0 ICU beds in the Jackson metro area and very few elsewhere. We're seeing a lot of stress in the health systems. We've been working with those guys a lot. We're seeing numerous outbreaks. We're having a lot more stress in our schools as far as outbreaks are going. And we're also going into the holiday season. And so we know there's going to be a lot of risk, especially if we look at the disease being transitioned from younger folks who do sometimes have very, very bad outcomes. I mean, let's not sugarcoat it. But then once it gets into the parents and the grandparents and that sort of thing, we see a lot of bad outcomes, hospitalizations and deaths and that sort of thing. So we're going into a very bad fall. It's very important for us to right now be very serious about this. Do everything we can to protect the vulnerable, protect ourselves, protect your family. Please take this very seriously. One of the things that we're killing ourselves is social events. We're still having parties and indoor events, and that's a dangerous endeavor right now. Strongly recommend against it. And Dr. Byers, anything you want to add to where we are right now before we get into that?
Well, just very briefly, looking at the last couple of weeks, we've seen more than 10,000 new cases, which is pretty astounding. We've seen almost 150 new deaths, which is pretty astounding. So I think the numbers tell us for sure that we are heading into an increase in our cases and a surge, and we're doing it right before the holidays, which is very concerning.
Yeah, we realize the holidays, it's very difficult to not be with your families, but we heard someone say, this year don't be with them so you can be with them in future years. We're going to start with true and false, and I wanted to tell you all, we got complaints for taking on and off our masks. We are all socially distanced, so gentlemen, if you want to take off your mask, apparently that was a bit of an irritant. And we're going to start with true and false, and I'll shoot a couple to you, Dr. Byers, first, okay?
Okay.
Okay, true or false, masks don't work?
False. Masks do work, and it's actually one of the best ways that we have for preventing transmission. Now it's being shown that not only does it help prevent you from transmitting it to the people that you're around, but it also protects you from infection.
So we actually have scientific evidence
We
of
do.
this. Okay. True or false, Dr. Byers, there should be a lockdown in Mississippi?
False. I think what we've demonstrated is that we just need to do things safely. Limit the number of gatherings, make sure that we're always wearing a mask in public, make sure that we're physically and socially distancing when we can, and quit getting into large groups unmasked, and that's how it's transmitted.
Dr. Dobbs, true or false, the Mississippi State Department of Health is responsible for enforcement of all COVID mandates?
That is false. There are a lot of the things that we oversee. If it's like a nursing home or restaurants where we have regulatory authority, we do make sure that they're working within the confines of the law and also the regulations. But the mask mandates are kind of outside our purview. We obviously very much support them and push for them, but obviously we're not a law enforcement agency.
Yeah, we get a lot of questions from you all about what can you do to enforce the mandates. That is really up to the law enforcement officials. Again, on this note, Dr. Dobbs, if a business is not following a mask mandate, I should call the health department. True or false?
Well, false, but if you do call us, we'll make sure we notify them. I mean, there's two sides to this. As from an enforcement side, we're not going to be the enforcement, but we will inform the mayor's office to make sure they know, and also we'll make sure that they understand what the rules are, because sometimes people are just confused. And the other thing is, there are liability protections that the legislature wrote into the law if they follow public health guidance. We want to make sure that they have those layers of protection, but to have those, you have to follow our public health guidance.
Thank you. True or false, Dr. Dobbs? COVID-19 is now considered a pre-existing condition.
That's a tough question, and I can't even ask it true or false because we're learning so much more about COVID. We do know that there are people who are chronically having issues related to it. So could it have some chronic, long-standing impact? Absolutely. We're seeing it more and more. So could it be a pre-existing condition? Yeah, I think it could be.
Okay, Dr. Byers. A mask is enough to keep you safe when at work, school, or gathering with others. True or false?
Well, certainly a mask is an important piece of it, but it's not the only piece. I think the science is telling us more and more the importance of mask and mask use, but it needs to be done along with the other things that we talked about, the physical distancing, the limiting the large gatherings, and so it's just one piece of the puzzle.
Okay, Dr. Byers, true or false? Social distancing at least 6 feet is just as effective as wearing a mask.
Well, it's really not. What we see is that social distancing is important. We need those people to be more than 6 feet away from each other, sometimes under the circumstances more than 10 feet away. But we also recommend that when you're indoors, like at a school, or when you go into a business, or when you're in a gathering, that you need to wear your mask too. Just gives you that extra layer of protection. And remember, we just talked about a second ago that it's not just one thing. It's all the things.
Okay, Dr. Dobbs. People who are currently taking blood thinners have some protection from a more serious case of the COVID virus.
That's going to be false. There will be people who do get blood clots related to COVID because it's not just a lung disease, it's a whole body disease. But you can still get severely ill, and we don't have any good sense that that's going to protect you from some of the bad outcomes. So that is part of the therapeutic approach for people who are very sick in the hospital to have certain forms of anticoagulation, but it's not going to protect you from severe manifestations of the disease.
Okay, and finally, Dr. Dobbs, true or false, is it safe for hospitals to let patients see their families?
It can be done safely. The health department doesn't regulate or micromanage how that operates. It's a hospital policy. But there are things that need to be done safely, right? We can't have you don't want to have unrestricted visitation, people walking around. So there are safety protocols in effect at every hospital, but those are determined by every hospital.
I want to shift gears now and talk a little bit about vaccine availability. It is looking like we will start seeing vaccines here in Mississippi maybe mid-December, late December. So, Dr. Byers, why don't I shoot you some questions and then I'll switch over to Dr. Dobbs.
Absolutely.
I have heard that we are looking at mid-December to start receiving.
And that's the information that we're getting, that it's likely that we'll get some doses by mid-December.
Okay, can you talk a little bit? I think there might be a lot of hesitancy out there, and I think it's only natural, about this vaccine. Can you talk a little bit about how a vaccine goes through a process so that safety is assured?
Right, and so there's a phased approach to looking at vaccines for not only the safety, but how effective they are. And right now, the vaccines that we're talking about, and certainly the ones that we may get in December, are going through the phase 3 clinical trials. This particular vaccine that we're talking about, more than 30,000 people have been given a couple of doses of it, and then they watch the safety profile and they watch the effectiveness. And so far, the information that we're getting is encouraging.
And this is the Pfizer 2-dose vaccine.
Right.
Okay, explain what an EUA is.
So that's an emergency use authorization that the FDA can grant, and they'll do that under circumstances where we're trying to get a medication or a vaccine out quickly. It's demonstrated that there's a good chance that it's helpful and that it's working and that the safety profile looks good, and so that's likely what the vaccine would be released under at this point.
But it's the same review, just expedited a bit.
It is. It's the same review process. We just haven't gone through that final step. But an EUA allows us to go ahead and start utilizing that vaccine.
Okay, Dr. Dobbs, I think it's a big question for you. Are you confident in this vaccine?
You know, based on the initial information we have, I'm feeling really good about it. I mean, the efficacy, although short-term, certainly, you know, meets and exceeds our expectations. And looking at the safety signals, they look really good. We will continue to look at them very closely. We are well connected with the people at the federal level, but also at the CDC and the Advisory Committee for Immunization Practice. These are external people. These are experts who are not in any way connected with the process, and we think it's going to get a good, thorough review. You know, but before we come out in strong support of anything, we want to look at it ourselves and make sure that we've seen all the data. But right now, I think things are looking very positive, and I would feel very comfortable giving it to myself and my family based on what we've seen so far.
You'll be the first in the state to receive it.
I'll be happy to do it.
Okay, we know we're going to receive about 183,000 doses. There is a plan in place so that those that need to get the vaccine first will in fact get it first. Dr. Byers, talk a little bit about how that distribution is going to take place, starting with healthcare workers.
So, yeah, and so it needs to be to the healthcare workers first. Those are the folks who are in the tier one, and the purpose behind that in vaccinating those healthcare workers first is to make sure that we get them protected. Those are the individuals who are taking care of the COVID-19 patients in the hospital or clinical setting. And so that's going to be the first push, is to get the vaccine out to the hospitals where they can begin to vaccinate their healthcare workers. There may be a combination as we move down the road where you know, the health department is assisting with the vaccination of those healthcare workers as well. But that's going to be really the first tier. That's going to be really the target with this first round of vaccine that we get.
And then I would assume first responders and high-risk residents would be next?
Well, the first responders will more than likely be included in part of this healthcare worker vaccination effort to begin with.
And we got a question about this from a reporter. Do we, Dr. Dobbs, have everything we need from the federal government? Do we need to ask for more doses? Are we getting what we need?
You know, we will need some more support. We've gotten a very minimal financial support for the personnel and stuff to pull this off. The other thing that we're going to need for sure is going to be ongoing support from the National Guard. They've been a fantastic asset. I mean, I just can't thank them enough for the great work that they've done, helping us with the testing. And for us to be successful, that's a very important part. So additional money to pull it off, and then ongoing support from the National Guard are going to be critical elements.
Okay. I've been told that this vaccine is not going to be available for children.
Not yet. There will not be a formulation that's yet available for kids.
So it's for 18 and older.
That's our understanding. We haven't seen the final released, obviously, EUA. Those details will be forthcoming whenever that's done.
And I know none of us have a crystal ball, but when do you foresee healthy people being able to get the vaccine? Would it be mid-spring, summer?
We don't know for sure, but we would think that, you know, some months thereafter that we do the phase 1 distribution and administration, we'll start seeing it for general population. So, you know, I would just say months, some months, and whatever that looks like. I think it also depends on how many vaccines are available, right? Mm-hmm. Because we have several in the pipeline. We have 2 that are really about ready for an EUA, the Pfizer and the Moderna. But we also have AstraZeneca and the Janssen version that may be right behind them. So I think that's another critical part of the question.
Yeah, so we might have multiple manufacturers and multiple vaccines available. That'd be great. All right, this is a 2-dose, Dr. Dobbs, this is a 2-dose vaccine. Explain how that works. That you take one and then wait a couple weeks, or what?
Yeah, so like if you've ever had like the hepatitis B shot and those sorts of things, it's multiple doses before you get adequate immune response. And looking at the Pfizer trial, you know, they saw efficacy. It was like, I think about 8 days after the second dose, it seemed like it was starting to be pretty darn effective. So it will be a single shot, and then 3 to 4 weeks later it will be a second shot. And a lot of our efforts and then efforts of our partners are going to be to make sure that people get back for that second shot.
And Dr. Byers, are we signing up physicians and pharmacies, that kind of thing?
Yeah, we are, and we are communicating with physicians. We're communicating with hospitals for them to do the sign up to be to give the vaccine when we get it. So we're working with them, and we're going to continue to work with the hospitals and the providers.
It's important to say that just because we start receiving vaccine, that does not mean that you do not have to follow the guidelines. Am I correct about that?
Yeah, and not only do we have to follow the guidelines about providers and hospitals signing up, but there's also storage and handling of the vaccine to make sure that not only is it administered properly, but it's handled properly, so we can make sure that it is effective.
There are challenges to handling the vaccine, one of them being that it must be maintained in a very cool temperature.
This initial one will be. It must be maintained at a very cold temperature, but we're working on the logistical plans to be able to make sure that we have in place the methods to logistically distribute that out.
When we talk about efficacy of this virus, it is 90% as compared to flu, which is only 50 to 60%. Dr. Dobbs, you had said it's healthy for people to be hesitant and thoughtful, correct?
Yes. Yeah, no, there's nothing wrong with being cautious, right? So, certainly understand that people want to make sure everything looks good, and we do too. We want to look through that first phase. Now, we're a lot more connected and see what's going on a little bit behind the scenes and understand the processes just intrinsically how this goes through. So I think once it goes through the full review process without any shortcuts, which I think is absolutely going to happen without shortcuts, at least through the EUA sort of mechanism, I think we'll feel pretty good about it. But the other thing is, people who are maybe a little bit on the late adopter, sort of a little bit on the, kind of want to wait and see a little bit, there'll be a lot of doses administered before it gets to the general population, so everyone will have time to get a sense of what what you would see.
Can pregnant women take this vaccine?
Right now, they're just still talking about it. They're waiting to see what the data looks like, and I think that's part of the discussion. I don't know right now, but I will just say that we really do like to give pregnant women a lot of vaccines like flu shot and pertussis. And one of the things that's important to know is that pregnant women, if they get coronavirus, have a lot worse outcomes than the general population. So that's something to consider, that they may be a group that would greatly benefit from COVID vaccine.
And I would assume at some point we will be giving these through our drive-through clinics as well, administering this vaccine.
There will be numerous mechanisms through which people will get it. The phase one will be mostly through what we call closed points of distribution, or closed pods. And those will be given to hospitals, to all their employees, or other big healthcare groups. But there will be mechanisms through which we will help other healthcare providers who are maybe not connected to these closed pods have access to it, and those drive-through sites may be one of the options.
Dr. Byers,
Yes, ma'am.
can you be reinfected?
Potentially, yes. I think there's more evidence that's being shown that reinfection is a possibility. I think in a number of circumstances, they have shown that people have been reinfected with a slightly different strain of the virus. So the answer is yes, it's possible.
Does this have mutations like the flu?
Not to that same extent, and I think that's one of the promising things with the vaccine, is that we don't see those same level of changes that you see with influenza.
Okay, I want to just make sure I got all the vaccine questions answered. Okay, we have a reporter, Ronnie Mott, saying the Pfizer vaccine is unusually difficult to ship and store. He read an article, and we've already talked about that, but we are preparing for the challenges here in Mississippi. And I think we have answered, we've talked, I think, a good deal. We want to go back. Most of you had questions other than vaccine availability, both the public and reporters, so we'll go to those again. Now, this is going to be for general discussion, not true and false. All right, Dr. Byers, since I'm looking at you.
Yes, ma'am.
Why won't you issue a statewide mask mandate with the numbers going up?
Well, certainly we encourage that everybody needs to be wearing a mask, whether there's a statewide mandate or not. It just makes sense. It's been shown that that's how we prevent transmission. So certainly we recommend that. And I know that Dr. Dobbs works closely with the governor's office as well to make recommendations about what counties what areas in the state mask mandates should be in place.
Yeah, we think that everyone needs to wear a mask when they're around other people that are not the nuclear family. So whatever is the best mechanism to achieve that, that's what we support. We are in the sort of like the high-risk counties right now, and so if you're in a high-risk county, you got to do it. But if you're not in a high-risk county, you still need to wear it. We've heard a bunch of stories about where, when the mask mandate fell, people had the false impression that the risk was lower. And it wasn't. The risk was not lower, and we've seen, especially in church congregations, big outbreaks because the churches let their guard down. And we know that churches are a real dangerous sort of environment for spread because not only do you have a lot of people who don't see each other all the time, so you have that, but you have an intermixing of young and old, and it's a real powder keg for outbreaks and deaths, just to be honest.
Well, what about sports? I know this is kind of a thorn in your side. Sports is another way that we are seeing COVID spread, correct?
Basketball worries us greatly. We've gotten through football reasonably well in the sense that, the outdoor environment's a safer place. But we did see a lot of outbreaks among the players. I don't know that they really caught it outdoors. They may have. But we know that indoor environments are so much more risky. There was an analysis of an outbreak in a hockey team, CDC did, and one person gave it to like 22 people on the ice rink. So that sort of thing demonstrates in the wrong setting, people breathing hard, indoors, close proximity, very worried about it. And I will say that it's been a little bit disconcerting, the prioritization we put on youth sports. There's two levels of this. You kids playing, and I know they want to play, and it's hard on them, and they're young, and their risk of adverse events is lower, but the attendance is another issue. And so I would just like to say very clearly to everybody is don't go to a sporting event. It's not safe right now. And so even if you're wearing a mask, if you're going to go because it's your kid, stay away from people, wear a mask. But I recommend that nobody go to a sporting event and be an observer.
Okay, so we got a lot of questions about enforcement, and again, we can only enforce mandates that are under our purview. So we have someone who writes in and says, there is no enforcement of mask mandates in retail establishments or local businesses, despite signs that are posted and the executive orders. What good is the mandate if it's not enforced? Is there a way to enforce it? So what good is it if it's not enforced, and is there a way to enforce it?
Well, there's a lot of layers to that. We're not the enforcement mechanism, right? So clearly understand we're not going to write tickets or anything like that. And these are the executive orders, and I certainly agree with those. But local law enforcement in some areas, they've taken it seriously, and I think it's been very much to their benefit. Businesses too have the opportunity to stand up. And if I go into a business and they're not following it, I leave immediately. I think vote with your feet a little bit makes a lot of sense because they don't care enough to preserve my health, then I don't care enough to give them my business. There's a lot of layers to it, but it's really a local control issue.
Okay. Dr. Byers, what are an employer's responsibilities in regard to cleaning, disinfecting, and all of that good stuff when an employee tests positive, particularly in regard to other employees who work in the same area? So let's talk about the responsibilities, sanitation first, and then the responsibilities to other employees.
Well, and certainly there are recommendations for cleaning up an individual's workspace that you identify who's been a case, and CDC's got some real clear recommendations that they have for what to do with an area where a case has been, just to cut down on the potential for environmental transmission. I think it's also important to remember that although environmental transmission can occur, the primary way that COVID is transmitted is through that person-to-person interaction. And so I think that they need to clean, but let's focus on those other things too.
So a lot of folks said, what can they do if they see their employer not following guidelines?
Well, certainly they can have that discussion with their employer. You know, we get those calls. We get a lot of those calls about employers not following guidelines, and you know, a lot of it depends on what part of the state that they're in. But you know, there are times that we reach out to employers and we make sure that they understand and have an understanding of what the clear guidance is.
And that would actually be to notify those around them. We do contact tracing.
Sure.
Okay, but there is not an onus to.
Oh, so from a standpoint of if there's a case,
Right.
man, we really encourage the employers to be transparent with their employees. You really have to do that because, I mean, if you've got a person identified within your employment setting who's a case, we really need that notification to the other individuals, because there's a couple of things that we want to do. We want to make sure that those people who are in contact get tested and get quarantined.
And when we started out, we had a lot of challenges with contact tracing, but we have a very robust contact tracing team. Dr. Dobbs, talk a little bit about our teams and also how quickly we're able to turn things around.
Yeah, and Dr. Byers may have some other stuff, but you know, we had gotten to a point where we were doing very well with doing all age groups. But you know, we've hired our own internal folks. We continue to add contract workers, nurses, to kind of be able to follow up on these, especially for the 24 years and under. But also, we've hired a large team of externally to do this. I will say though that as these numbers increase, then the capacity to do that is diminished. I do want to say something very clearly though, and I do want to just make everybody understand, there's no amount of contact tracing that's going to control the pandemic, right? It's only a piece of the puzzle. All these things work in concert. So when we find somebody, mostly they've spread it to who they're going to spread, and we're trying to stop that next round. The other thing is if you are a case, please share all the information with us, especially young folks. You've seen a lot of reluctance for them to share information with us. So there are gaps in that. It's one piece. Everybody needs to do their part. We are working our tails off trying to do our part. I mean, really, we are. We need everybody out there to do your part, and that means it's simple stuff. It's wearing a mask when you go out. It means not having a social event indoors, and if you're going to do it, to keep it small. It means not having a big family gathering, and where you're going to cause an outbreak. And we see that over and over and over again, and it's not worth it for you to cause an outbreak in your own home and then be responsible for someone to be ill or even someone to die. The onus is on all of us. We all are responsible.
And I'd like to echo too about the contact tracing piece, that we can't just rely on that solely. And I would encourage folks, if you're infected, if you get diagnosed by your doctor with COVID-19, don't wait for somebody to call you to tell you to isolate. Isolate. You need to do your part to limit the transmission. If you know that you've been exposed to COVID-19, or you think that you've been exposed, get tested and quarantine. And if we do those pieces along with wearing the mask, we can really impact transmission.
And the quarantine is 10 days?
So a quarantine period is 14 days from your last exposure. And the isolation period gets very confusing. The quarantine is for those folks who are contacts. Isolation is for the people who are infected. And the isolation period is 10 days from the time that you first got sick.
I should do this set up. All right, let's talk about mask mandates in counties, specifically DeSoto and Lee. Dr. Dobbs?
Yeah, so we do have mask mandates in quite a few counties, and I'll tell you, by and large, and it's been pretty encouraging, that we've seen when counties have instituted a mask mandate, they've had a pretty rapid decline in cases over time, and that happens statewide too. And it's not just mask mandates, but also in the order is a limitation on group size and that sort of thing. So those kind of work hand in hand. DeSoto is a bit of an outlier. Lee less or so, but DeSoto has put up a little bit of defiance in these preventive measures, and so they haven't seen. You know, it's hard to say for sure that one causes the other, but certainly DeSoto is on fire. I mean, it's red hot cases, And if I lived in DeSoto, I wouldn't go out. I'd stay in my house as much as possible and be very, very careful, because the communities in DeSoto County are absolutely eat up with coronavirus.
But when you embrace the mask mandate, I think for those counties, I think we've demonstrated that you can see a pretty rapid decline in the overall number of cases that are occurring in those counties. But it takes that embracing.
Well, one of the things I just want to say is we do need law enforcement officials in DeSoto County to help us with this mask mandate so we can save lives. It should not be taken lightly. Can you explain, Dr. Dobbs, why it takes so long to report COVID-19 deaths from death certificates?
So any of you who work in healthcare or docs know that when someone dies, there is many days delay between the death and the completion of that death certificate, and then for it to get to us. And sometimes that delay can be more than a few days. It can actually be quite a long period of time. So that's a big part of it. But the other part of it is when we do get a death certificate, we review it very closely and do some research to make sure that it is truly a COVID-related death. And so part of it's the intrinsic nature of that reporting, and the other piece of it is just the validation piece that happens after that.
Okay, and Dr. Dobbs, when we see a day with no deaths, does that mean no one died the day before, and we know that's a no?
No deaths just means that none have been reported, and that's mostly going to follow a weekend, because we know clinics are closed, and the healthcare operations are not going to be quite at the weekday sort of level. So it's just a delay in reporting.
How long, this is from a general public question, how long does it take for a typical COVID-19 death to get reported to the Msdh and then posted online?
Yeah,
So most of the time those are called in by the healthcare providers of the hospitals or long-term care facilities. So it's usually just a matter of a few days.
Okay, Dr. Byers, you get this question. Will a new president in the White House change the way Mississippi is responding to COVID-19?
Well, I certainly think that there may be some changes, and I think that we've seen some directional changes already. But a lot of that remains to be seen, and we're going to do our part in Mississippi, and the basic pieces that we need to continue to do are focusing on interruption of transmission, and when we get the vaccine out to folks.
And why, and I think Dr. Dobbs answered, but I'll have you answer it too since this falls under your area. Why are the case numbers lower on Sunday and Monday? We get asked this all the time.
And it's the same with the deaths, and it's really, it's more of a reporting issue rather than an occurrence issue.
Okay, Dr. Dobbs, when is the health department going to promote proven COVID-19 preventions other than masks and social distancing, such as vitamin D, C, and zinc? The science is there, unlike for masks, which we know is not true. The science is there for the mask, but not these vitamins.
Yeah, so there's nothing wrong with vitamins. Vitamins are very good for people who maybe have nutritional deficiencies, and certainly that's perfectly fine. But vitamins are not going to protect you from coronavirus. They're absolutely not going to protect you. The science piece, whenever I ask people to provide science, I never get any articles, right? So if there's stuff out there, and we're looking at it all the time, even if you go to WebMD or if you go to Mayo Clinic, very clearly they say vitamins will not prevent coronavirus. So I would encourage everyone to really look at the sources of the information. I get a lot of people telling me that some great new cure, and it's some excited person on a YouTube video, which is absolutely not science. And we do know masks work. I mean, and that not only do we have evidence from pre-COVID, we have improving evidence about how it works collectively. If it's kind of like if it works great, it works reasonably well one person, but if we're all doing it together, there's a force multiplier that makes all the difference. Why in the world is Taiwan, a country of 23 million people, only have a few hundred cases and a handful of deaths, and a roaring economy? It's because they're wearing a mask, and they're not having social gatherings, and they're staying away from each other than when they're working and other stuff. We've chosen the wrong path. Unfortunately, it didn't have to be this way.
And is it true that we all know wearing the mask protects others from getting what we have, but can it also help us too, as far as those droplets and everything?
Absolutely. it does help us. I mean, it does diminish the intake, but there's a growing body of evidence and certainly some interesting evidence that if you are exposed, it decreases the inoculum, the amount of virus you're exposed to, and it appears, and certainly this is something we continue to learn, but there's reasonable evidence that your infection will be much less severe if you were exposed to a smaller dose of infection.
Okay, Dr. Byers. I went to a doctor's appointment and many of the staff weren't wearing masks or had them below their chin. Why aren't all healthcare staff following the precautions?
Well, that's disappointing. And certainly, it is our recommendation that if you're a healthcare worker and you're interacting with a patient, you need to always wear appropriate PPE. Because not only are you, as a healthcare worker, preventing infection from yourself, but you're preventing transmitting it to those individuals that we care for. So, healthcare workers are supposed to be. They should be wearing appropriate PPE. They should be wearing eye protection. They should be wearing a mask. Well, that's our recommendation, and that's a recommendation from CDC as well.
We got a lot of these type of questions from the public. This question, as you may be aware, isolation is detrimental to the patients in nursing homes. Please explain why the nursing homes are prohibited from raising the windows of a patient's room so families can have meaningful visits while wearing a mask, with a window screen between patient and family member, and patient being at least 6 feet from the window. Shouldn't this be safe, Dr. Dobbs?
There are mechanisms for folks to have more meaningful interactions with their family in nursing homes. Very clearly, you can have outside visitation almost at any point. And right now, there are clear guidances that if you're outside of an outbreak window, you can actually do indoor visitation with some precautions. So there is more and more visitation available. So please, I encourage you to go to our website. It's under our licensure section, and to see what the rules are and the guidelines, because the nursing home stuff is really dictated by federal laws and federal regulations. So a lot of that's really outside of our control. But yeah, there's opportunities to visit. So please, talk to administration of a nursing home if you don't think you're having access to your folks, because there are mechanisms to do this safely.
Okay, I'll start with you, Dr. Dobbs, on this. If the COVID genie could grant you one wish to change or modify the behavior of Mississippians so as to better fight the virus, what would it be, Dr. Dobbs?
It's not masks.
No?
It's groups, gatherings. We are, if we, and that's one of the reasons why I think Sweden's done relatively well. They're different, right? 40% of people in Sweden live in their house by themselves. So they're the highest in the world by far with people in single resident dwellings. It's more than 40% even. But also, too, they took very seriously the public guidance. And so I think they do better with masks, and they haven't done as well as other Scandinavian countries. But they're very good about not having as many parties and stuff. If we could have no indoor parties for the next 3 months, that's it. That's what I would ask for.
Well, based on that, the next question is, based on the level of community spread in Mississippi right now, is Thanksgiving canceled?
I wasn't aware that was under our purview either. But of course, Thanksgiving's not canceled, but we do recommend, and CDC does too, that we keep it tight, keep it small, keep it nuclear. Be around mostly your tight family. Travel and big gatherings are a really bad idea. And we're going into the meat of it. Dr. Byers, I think you...
Well, yeah. If I could throw one other thing out there, please don't go to Black Friday. Don't go out into those big gatherings the day after Thanksgiving. That's going to be a disaster of potential transmission. And we just can't keep doing those big gatherings and then be perpetually surprised at where the cases are coming from.
Dr. Byers, do you have a personal story or anecdote to share with us regarding COVID-19?
Well, it's the deaths, and I have to tell you, we review a lot of deaths. We review deaths in children, and we've had at least 3 deaths in young people, and when you look at the individuals under the age of 24, we've had even more. Those weigh on you, and that really brings it home to what we're really dealing with here is, most people, the younger folks, they can shrug it off and they don't think much about it. But we do have young people who are impacted, and it is devastating for those families. And we, see young people can be the individuals who can then transmit it to a parent or a grandparent who's at high risk and vulnerable, and they can have severe outcomes. So I feel those deaths, I have to tell you.
Dr. Dobbs, do you have a personal anecdote?
Yeah, I do. Someone very close to me in my family, she had a lifelong friend. They were best friends, and they in their 60s, and they were going to plan to take care of one another as they aged and spend their senior years together, right? And in reasonably good health, and they had planned out their life together. They actually had their names on each other's checking account. Right, they were really tight, and one of them got COVID and died in the hospital, and so that's the thing that drives me crazy. This doesn't have to happen, and our complacency with this absolutely it really keeps me up at night sometimes, because now her best friend is gone, and a whole decades of a wonderful life together are erased because a single moment of infection. And she's in her 60s, but it doesn't mean she deserves to die. And we shouldn't write off people just because they have diabetes or are overweight or over 65 that they deserve to die from COVID. The selfishness of this, it just wears me out.
Well, I know, we have learned a lot since the virus started, I think in December, but here we didn't have our first case until I think it was mid-March. But Dr. Byers, we've learned a lot along the way about COVID, but what has surprised you, either with people's reaction or you? I mean, what has surprised you the most from dealing with COVID virus?
Well, I think it shouldn't surprise me, but I think that one of the things that surprised me is how difficult it's been to impact the behavioral changes of just wearing a mask. And, it can seem intuitive, but I know that there's still a lot of people who are just not following the guidelines. And if we would do that, if we could get 80% of the people in Mississippi to wear a mask and wear it when they're out in public and wear it consistently and appropriately, I think that we could see a marked decline within a matter of weeks in the number of cases that we have now.
Dr. Dobbs, what has surprised you?
Boy, I've been surprised by so many things. I mean, that surprised me too. I mean, our planning assumptions, we figured sort of steady behavior. That's been pretty difficult. I've been surprised. I'll be surprised about a good thing. How about that?
Okay.
I've been surprised about how rapidly we've been able to bring on some effective treatments and maybe even a vaccine. We have Remdesivir, which is, it works okay. It's fine. But within a week or two, we're going to have a monoclonal antibody available that we'll be distributing to hospitals pretty soon. That's going to be only for at-risk people as outpatients who are not hospitalized.
And to explain what that is, it's kind of like Tamiflu for the flu.
Yeah, it's kind of Tamiflu, but it's the same sort of thing that the president got when he was initially ill. So that's great. And then having potentially an effective vaccine within 10 months of the onset of a pandemic is absolutely fantastic. So I guess I want to be surprised in a good way.
Okay.
Once, yeah.
All right. We have someone who wrote in saying some people, including children, have had nausea and vomiting with COVID. Should those who think they have just a stomach virus be tested for COVID?
COVID causes so many things. We've seen a lot of kids who've just had nausea and vomiting. If you're asking if you should get tested for COVID, you should get tested for COVID. I mean, that's always the right answer. On a multiple choice test, getting tested for COVID is the right answer. And we do have, I want to remind everybody, we have free drive-through testing clinics in every county, pretty much at least twice a week now. We have it daily and Saturday here in Jackson. So One of the things though about that is actually our appointments have been filling up the past week, which is a pretty strong indicator that we're having it. And then we did rapid tests if you're symptomatic or if you're exposed, we'll do a rapid. And of the 800 or so rapids we did this week, on one day, we had about 140 positive rapids, which is an astounding number. It may not sound that way, but through one day to have 140 rapids just from our drive-through clinics, and that's not even PCR, is astounding.
But they were confirmed by PCR, were they?
Oh yeah, they were real
Yeah,
cases.
okay.
Yeah.
All right. Many places seem to be using, and we do this here, we do temperature checks, whether someone has fever as a determining factor to whether the person's sinus systems, cough, stomach upset might be COVID related. Should the absence of fever be used in this way to preclude COVID testing?
The fever check is just one of several things you need to do. It'll miss most people, just without a doubt. Most people who are contagious are going to miss on the temperature. I will say, in some of the outbreaks that we've seen, people will walk through that door and do a symptom check and lie because they don't think it's bad. Do you have, cough, congestion, whatever? And they do. And they just say no because they're trying to say something else and they have COVID and they spread it to a bunch of people. So please remember it's the temperature thing. And we've caught people, we've prevented outbreaks this way, but it's only one of numerous mechanisms. But the symptom piece is very important. We should take it very seriously.
And let's just reiterate, because we did get several questions about this. If someone you know tested positive for COVID, you should get tested and you should quarantine.
If it's a close contact, if it's a household contact, yes. Everyone who's exposed to a COVID case should get tested. We recommend that. And if we consider a contact anyone who's been within 6 feet of someone for 15 minutes or more, even if it's not a sequential period of time, if it's a come and go sort of time, then that's a person who needs to be quarantined.
Okay, Kobe from radio station Mississippi Public Radio wants to talk about R0, and we do get questions about R0. So quickly explain what R0 is and if it's an important number or not.
Yeah, R0 is basically how much is it spreading? It's the reproductive rate. It's on average how many people are getting it. How many people are getting it spread from one case? So if our R0 is 2, it means on average each person is giving it to 2 people. And if it's 4, on average each case is giving it to 4 people. So it kind of tells us how infectious it is in the community right now.
How contagious.
Yeah, and it's not just intrinsic to the virus, but it reflects behavior.
Is it an important number, Dr. Byers?
Well, it can be, but I think one of the things that people need to be looking at as well is something that's very intuitive, and that's the number of cases that we're seeing. Regardless of the R0 right now, we are seeing a significant surge that's having an impact in the number of deaths. It's having an impact in long-term care settings. It's having an impact in hospital capacity. I don't think you need to have another number to tell you what's actually happening in the real world with what's going on now.
Okay, and positivity rates. Talk a little bit about what that means and if it's an important number.
Well, it can be, and it can sometimes be an indicator of a county or an area or a state where there's going to be some increased activity. Basically, what it is it's the percent of total tests that are positive over time in an area. I know that it's used a lot to try to inform where there may be hot spots. It's used to try to inform where there are areas where we might see increased incidents, where additional measures may be taking place. But, it's just one of those things. It's not the only thing to look at.
We heard a lot from people that have been diagnosed with COVID. And one person said, I was diagnosed and tested for COVID 6 weeks ago. How long does it take before your smell and taste come back, and can it cause permanent damage? It has taken away my food cravings and my appetite, and I don't feel like eating. So, Dr. Byers, will this ever come back, or do we not know?
Well, I think for most people, we don't know exactly, but for most people, it can take a while, and they do recover those things like sense of taste and sense of smell. I think there's still a lot that we're learning on what are going to be the long-term consequences as a result of infection. But by and large, most people have recovered that sense of taste and smell.
Okay, we are starting to run tight on time, and we still have a lot of questions, so we're just going to shoot these quickly. All right, we got a lot of questions about schools. Okay. Will masks be required for the rest of the school year?
Masks are currently required for everybody in a school, or if you're a parent visiting a school. So right now, private and public, gotta wear a mask. Will it be for the entire school year? Boy, it'd have to be pretty dramatically better for us to imagine that wouldn't be the case. We're seeing a lot more schools going virtual now. And I think that's not a bad idea. As hairy as it's been, we have seen a phenomenal number of school outbreaks. And right now it's a hard time. We've done really well so far, but we're starting to see some chinks in the armor.
Okay, so a while back, I don't remember, has it been a month? When did school start reporting? September?
Back in August.
In August. Okay, and so all schools are required to report their numbers weekly to us, and then you see it posted on our website. Yet, we are seeing a lot of the private and independent schools not reporting those numbers. This person wants to know, why are they not reporting them?
Well, they need to, and it is a public health order, and so they're going against the legal mandate to report. Now, that being said, please know that we want to work with schools in a collaborative manner. Not only do we want them to report, we want them to report accurately, and we want them to work with us when they have outbreaks, because inevitably they will have outbreaks. It's lamentable that there has been unnecessary pushback on this. I'm a little bit baffled by it, to be quite honest. But we'll continue to try to make sure we recruit ongoing partnerships with schools, whether they're public, private, parochial, because all kids are valuable, all teachers are valuable, no matter where you're working, and we want to be there for everybody.
Okay, we've got a lot of folks that are wondering about the holidays and their kids coming home from college, so we'll try to hit a few of these real quick. Families of college students are beginning to wonder how to bring home students and keep their families healthy. Some students would like to be tested before coming home to family, even if they have no symptoms or have not had contact with someone who is positive. What are your thoughts, Dr. Dodds, about that?
Right now, all college students can get tested for no reason.
That's right.
So, and we will encourage people, especially if you're a college student and you live with someone who maybe is older or has a medical vulnerability, to get tested when you come back. We're going to look at increasing availability of testing within the college towns, or you can get it done elsewhere. But a test is not a passport to safety, right? It obviously didn't work at the White House, right? And a test is just a point in time of now. And a rapid is going to miss you if you're early infection or if you're asymptomatic. So it's just one thing we should do. But even if you do get a test, please be careful. Maintain that space. If you had everybody, a big group of people, and they all had a negative test, I still think it's a high likelihood of an outbreak.
And they should, before your kids come home, they need to really modify their activities and not go into group settings, not go to the bars, and do that for a couple of weeks before they come home to limit their exposures before they come back to the house.
Well, and on that note, Dr. Byers, we have been asked, when should students get that test? Like, if they're going to go home in 2 weeks, when should they get it?
Well, and there's probably not a magic number, but before they go home, within the couple of days before they go home, with an understanding that test is just a point in time and tells them at that moment whether they were infected. It doesn't tell them that they may be incubating. And that's why it's important to do the other thing and to try to limit your exposures on the front end so that you don't bring that home to mom or grandmom or somebody else in the household who may be at high risk and vulnerable.
So we are going to get ready to close, but there's a few questions about flu. Flu season is here, and we encourage everyone to get their vaccines, and they're available at our county health departments. Dr. Dobbs, talk a little bit. People sometimes have confusion that flu is not a reportable disease, and explain how we do that, how we geographically look at flu.
Yeah, first, just really want to strongly encourage everybody to get a flu shot. If you haven't had one yet, I've had one. I know Dr. Byers had one because we got it at the same time. Get your flu shot. We do have flu shots available for kids and also adults who don't have insurance or are underinsured. So, we're here as a resource for those who don't have access otherwise.
Talk about how we have folks in the field, we call it a sentinel system,
Yeah.
where they report symptoms to us. It's not reportable like, say, HIV,
Right.
but we get a sense of the geographic spread. Have we had any reports yet?
Dr. Byers is a lot more in tune with that. So.
It's pretty limited. We've not really seen any flu activity yet, and that's not unusual for this time of year. As we get into November and December and January is really when we start to have our flu activity pick up. What we don't know is how's it going to be moderated by some of the measures that have been put in place to try to limit COVID transmission.
So do we count influenza deaths?
Well,
Do we have a way of tracking those?
influenza deaths are looked at through our death certificate data. Certainly we track pediatric influenza deaths because of the importance of those, and those are reportable in the state, and certainly we report those out publicly when we identify one. But you're right, individual cases of influenza is not something we track. We look at the overall sentinel surveillance system.
And pneumonia deaths, someone wants to know about that if we track pneumonia deaths.
Yeah, and we get those through our death certificate data as well.
Okay, I think as we wrap up, Dr. Byers, quickly talk about the hospitals and what's going on right now.
Right, and I know that Dr. Dobbs is really more in tune
Okay.
with what's going on with the hospitals.
They are plumb full. I mean, especially the ICU side. And it's not just coronavirus stuff, it's a lot of other stuff, but the coronavirus increase is putting additional pressure. And please go on our website. You can go to your town and your city and see what's going on in your hospital. But, it's a resource that's a little bit tight. A lot of winters as we go into the flu season, it's a real challenge. I had a hospital call me yesterday because they couldn't send a patient anywhere, and they were trying to send them to Pensacola because they couldn't get a bed in Mississippi or in Mobile or in Birmingham. I mean, it's really tight. So please be careful. Be careful not only because we don't want to spread coronavirus and overload the system, but be careful because there's nowhere for you to go. If you have a car wreck. I mean, really, it sounds kind of dramatic, but it's just really the way it is. And, we've been talking about this for a long time, and I think unless people have the personal experience,
Right.
Unfortunately, we're not having a collective appreciation of how serious this is. This is extremely serious, and we're all connected. So if we do those simple things, but we got to be extra careful, please, right now, protect yourself, protect your family, and let's protect the vulnerable because it's going to be a rough few weeks.
Yeah, and I think really, unless you're personally affected, which I was, because my husband had an embolism and we had to get him to a hospital, and fortunately there was something available, but if there had not been and we had to go elsewhere, that would have been an incredibly difficult situation. So please don't think there are endless hospital beds available. Dr. Dobbs, last words.
Yeah. Please, everybody be careful. Going into the holiday season, there's a real possibility for this to be even worse. If we would just all do the right thing for about a couple of weeks, it'd be amazing. And it's not that hard of stuff. I'm perpetually amazed, and I think there's a lot of reasons for it. I know there's a lot of chatter and a lot of noise in the background, but I just ask you to please pay attention. A couple of weeks, if we just moderate our behavior, wear a mask in public, don't go to social gatherings, it'll be a remarkable difference. And the other thing is, with youth activities, we really got to curtail those. If you're a parent, don't sponsor a party. You're gonna cause an outbreak. It's just happening over and over and over again. Please be careful.
Dr. Byers, any last words?
What do you say? No, we've demonstrated this over the summer. What works, we know what works, and when we're wearing a mask, we're not doing it just for ourselves. we're doing it for those people around us.
Okay, thanks. We thank all of you for joining us for COVID and You today, and we appreciate all your questions and your input always, and we hope to have another show for you coming up soon. But for now, we'll say good afternoon.